One way to help manage our healthcare budget is to learn about cost variation. Did you know that the price of a medical service or procedure varies by provider? This is called cost variation. There's no correlation between price and quality of services received, yet prices can vary by about 70% across the state.
A medical provider will perform the same exact services, but determines a pricing structure based upon what insurance companies agree to pay. We can affect healthcare spending by choosing to receive care at facilities that charge less.
The USNH Health Cost website provides information on the prices of medical care in New Hampshire. It makes health cost information easier to find and understand. It can help us bargain shop for healthcare like we do for plane tickets or a new car.
Let me show you how it works by clicking Get Started. Hypothetically, say I injured my knee and my physician told me I needed an MRI. I click on Radiology and then MRI knee. Then to make sure price points are accurate, I select the type of insurance I have, which is Faculty and Staff HMO. Here are the detailed cost estimates for having an MRI in New Hampshire. This chart is an example of cost variation. These numbers are accurate today, but since they're updated quarterly, may be different when you look at them. So check here before deciding where to go. I can expect my insurance company to pay as little as $900 for my knee MRI, or more than $2,800 for the exact same test. The only difference is the location in which the test is performed.
The reason to care about cost variation is that if we pay 50% more for an x-ray at one institution compared to another, and it's the same quality of film and interpretation, we're essentially taking more out of our budget than we need to.
It may cost you only $10 immediately, or it may cost me $10 immediately as an out-of-pocket copay, but the fact is that it's the total costs that we have to be concerned with. Somebody's got to pay that, the rest of that insurance bill. And while it may not be you or me immediately, we may think immediately only about the $10 copay. The fact is that sooner or later it comes back to you and me. It comes back certainly to USNH. They've got to pay the rest of that bill. And ultimately that comes back to you and me, because that's every dollar they spend in paying the rest of that insurance bill is a dollar less they have to contribute to other things, including our base pay. So we all really have an interest in trying to keep health care costs down.